And then he went away from the practice for a little while, and then he came back, and his periodontal disease has gotten worse, and so his teeth were moving around, and they wouldn't support his partial dentures anymore. And so I suggested to him that we could take out the rest of his teeth, give him full dentures that were supported on implants, and they'd be rock solid.
They feel exactly like my own teeth, and I find it hard to believe that any other dentist could have did a better job than he did. I would recommend him to anybody, my family, my community, whoever. He's good, he's professional, and he does good work. Yeah, and very personable. Yeah. Like I said, he's my white soul brother.
Okay, Dr. Bowers, met patients today, gotten implants, they all seem to think it's so easy and it's so great. I've talked to you about education and the importance of it. Talked to Dr. Luckman earlier about technology and about other things that bring stuff to your practice that most don't have. Now, I'm holding in my hand a handpiece. And you said, well, the average dental drill turns at 100,000 revolutions per minute, which is like hauling. And that a big problem is bone burning.
Right.
That a guy doesn't know what he's doing, gets a high-speed drill, gets in there maybe just for like, and at 100,000 RPMs, I can't imagine it would take more than and it's burned.
Right.
Okay. You made no big deal about this. I could have went out and bought a car for what this cost. What kind of difference does this make to the patient's safety and security?
It makes all the difference, because you can't even place an implant doesn't go as far into the bone as people think. An implant, there's even a system out on the market that it's called a rescue system to try to replace implants that were placed wrong or didn't take. And
obviously, if there's a system out to fix it, there must be more than they try to get you to believe failing. Because I have people, well, 99 or 98%, which may be true overall, but there may be some guy that 50% fail.
There are. There's people actually that have lost their license because of putting in implants.
But the message being put out, you know, I watch TV, the implant center, show up and we'll stick 9 implants and send you home. And I think, you know, as a patient, you look at that and think, wow, that's cool. And we talked about it. And you go in there and there's 40 different doctors. They don't know your name. They don't know anything about you. And this is literally surgery.
Right.
This is like going and having your arm worked on. I mean, you wouldn't walk into a hospital and have them do shoulder surgery. You want to know the doctor, his qualification. So what can go wrong? I mean, in the hands of the wrong person. Give me some.
Well, if you don't have enough training, you don't know the anatomy, you don't know where all the blood vessels and nerves are, you don't know how deep the nerves are, you can get someone who bleeds and can potentially be life-threatening. You can get somebody who has a permanent numbness in their lip, cheek, tongue, because you didn't know how deep the bone was before you got to the nerve. You can have all of that. It makes all the difference in the world if you know, first of all, what's supposed to happen. If you know, second of all, 2 or 3 different ways to make that happen. And third, what to do if it doesn't go exactly the way you wanted it to. There's a lot of people that, like we've talked about, that I see that maybe had a different kind of implants placed. Implants have changed a lot in the 30 years that they've been here in the United States, and so they've gotten a lot more dependable, a lot more stable, and there's been a lot of research that goes on behind it, which a lot of people don't take advantage of that research because they figured that, hey, I got all the continuing education I need, I'll just go do this. And you can never have enough continuing education. You never stop being a student. There's always things to learn. There's always new ground to break, and to see your patients and have them have what's the most up-to-date available technology going. And I consider all of my patients like my family. I don't want to sit there and be putting 20-year-old technology into their mouth when they go to their neighbor and they talk to their neighbor, and people talk and they say, hey, well, my dentist did this, and I say, well, my dentist didn't even tell me about that. That's another thing that's important to me, is I stand behind my work. If you have people that they do have a problem with something, they have a question about something, I'm open to hearing taking the time to call you in the evening and see.
We know that your partner practices sleep medicine and some TMJ therapy with this joint, and I saw that you have everything to make sure that that jaw is perfect when you're done working on them. How important do you think that is versus just going to somebody that's just going to put it in there? You tend to look at the whole picture.
Well, you have to, because unless you know what the person came in with, if you don't have any baseline to start out with, you don't have anything. It's like going to have the guy work on your car, but you say, oh, but I'm not going to let you hook it up to the computer, and I'm not going to let you, do the timing. I'm just going to have you just kind of, guess. I don't want to guess. I don't feel comfortable guessing. I want to know what's going on with you before you see me, and I want to know after I've seen you and treated you that I've improved your situation, or why come see me.
Talking about improving situations, we talked this morning to Herman, I believe.
Yes.
Yeah. 2 implants,
Yes.
secured his dentures.
Yes.
The man says he can eat whatever he wants.
Anything.
Every denture where I know usually either uses a blender or eats a lot of applesauce and cake and and then their health tends to fall apart because they can't eat. Is that normal? Can 2 implants, that simple, make that big a change in people's lives that wear dentures?
Yes, they actually can. You actually want to put, especially right here in the front section, there's between here and here, you don't have nerve, you don't have blood vessels, you don't have anything, and there's a lot of good bone. The best bone actually in your whole mouth is right here, between here and here on your lower jaw. And that's the best place of all to anchor any kind of denture. You can put in 2. If you can get in more, it's better to anchor it with more.
And you told me with implants you can completely rebuild their teeth could be horrible. You could take them out, put in implants, give them a whole brand new bite, give them the bite they had and the smile when they were 20 years old.
Yes, I can.
Let me ask you, who actually benefits the most from dental implants?
It's the people who've worn dentures for a while, and they understand that that's not a really good dental solution to their problem.
So they could have worn dentures for 15 or 20 years, and you can still put in implants?
Yes.
And then their dentures are secure. No more flying out when they talk, no more. They can go out and have a steak dinner, go on a date. I met a lady that hadn't been on a date in 10 years because her afraid her dentures were going to fall out. She can go out and not have any worries about that?
Yes.
What do you like best about what you do?
Mike, I think that we take for granted, because we have our teeth, what it's like to smile every day, to eat anything we want every day. And someone that's a denture wearer, they can't do that, and we don't know what that feels like. And so it's important to give that back to them.
Yes, I would say he's very thorough and explains in great detail the procedure he's going to accomplish, as well as the reason for it, too. I think that's very important.
He's a very caring dentist. He's gentle, and I wouldn't go anywhere else.
Very considerate of me. As a matter of fact, he makes sure that the numbing process has taken effect, very important, and then he goes to work on me. So that's the procedure that I've always found very effective.
I say I love him, MPDC. MPDC. Madly, passionately, divinely, completely.
Dr. Bowers, I want to thank you and Dr. Luckman for allowing my crew and myself to come out today to educate us on dental implants, on full mouth reconstruction, on sleep apnea and snoring.
My pleasure.
But I do want to ask you, a lot of people are going to have questions. Obviously, we don't have enough time to cover every issue. I hate to put you on the spot a bit, but if people have questions, if they have concerns, if maybe they need a little bit more information, is it okay if they contact you? Can they call your office, visit your website?
Absolutely.
Well,